Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited to have on my show Dr. Neil Nathan, author of the best-selling book, Toxic, Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illnesses. In this show, Dr. Nathan shares his knowledge on what is the root cause of all of these conditions that sometimes might be a little bit ambiguous and difficult to diagnose. Also, I was recently invited as a guest on the Health Hackers FX Summit. Check out the link and learn from some of the most influential figures in the health space about how to be your own health advocate. I hope you enjoyed the show. Hello everyone, super excited to have on my show Dr. Neil Nathan talking about a very sometimes controversial illness that might not have a common denominator or might be underdiagnosed. He just released an awesome book on chronic illnesses. You just think about it like Lyme disease, Bartonella, mold toxicity. Dr. Neil Nathan, how are you?
I'm fine, thank you. Dr. Ruiz, how are you?
Doing really great. We've been trying to get this scheduled for a while and we finally made it happen. So, in true 3030 health fashion, can you tell my listeners your hero story? How did you come around into this health space?
First of all, I don't think of myself as a hero.
Well, you are.
Well, that's great, but I don't think that was ever the goal. For as long as I can remember, I always wanted to be a healer. When I went to medical school, I was somewhat disappointed because they weren't going to teach me to be a healer. They were going to teach me to be a medical technician. And that was a bit of a shock because I thought that healing encompassed everything. And this was in 1967, keep in mind. So this is before anybody was talking about mind, body, spirit, holistic medicine, or anything like that. It just seemed obvious to me that human beings were in a complicated interweaving of all of those really important things, and that merely studying anatomy or biochemistry or physiology wasn't sufficient to explain what a given human being was wrestling with. So I was a bit frustrated in medical school, and I will say that the one influence I had in medical school was Elizabeth Kubler-Ross, who is a genius who began to understand death and dying in a more profound way, did have a weekly seminar in which she would teach us how she spoke to patients and how she worked with them. And that was the only role modeling that I got at that time of what I was looking for. And so, and just in terms of my journey, I don't know that we need to go into that, but in terms of the, quote, hero journey, unquote, when I left medical school and I completed my training at San Francisco General Hospital, I then went into the Indian Health Service and had the opportunity to study Native American healing practices and began to passionately look at as many different approaches as I could find that would improve my ability to help people get well. And over the years, that included hypnosis, homeopathy, acupuncture, getting back into biochemistry in greater depth, which people now call functional medicine. I became a specialist in pain management. I learned a whole bunch of interventional techniques. I studied osteopathic craniosacral work and have for about 40 years. And there's more, but all of those things gave me more tools to help people to get well. And I began to try to figure out which tools were best for which patients. And I didn't think of it as a hero's journey. I just always wanted to help people. And that was the path that opened up to me, and I was very, very fortunate in getting wonderful healers that included me in what they were doing and how to do what I did better.
The saying, when people say, oh, alternative medicine, there's no alternative, it's either medicine or not medicine. So, we're not doing alternative medicine. We're just, like you said, you can call it physiology or functional medicine or whatever you want to call it. It's just medicine.
Right. I mean, medicine is applying what you know to help people. And from my very simplistic way of looking at it, the more I knew, the more I could help people.
And we can help people in so many different ways. You touched on mind-body medicine. You touched, on physiology. You touch on, touching people can be healing, and all of these modalities give us such a wider breadth of healing capacity. And that is something that is really missing in our current model of medicine. It's a little bit myopic.
Oh, very, very much so. Particularly because the model of medicine that currently exists is pretty much based on what I will call acute care medicine, which is if you have a strep throat, you get your throat culture and you get given penicillin. Or if you have a gallbladder attack, you get your gallbladder taken out. And that's very good medicine for those problems. But we're now living in a day and age in which the world that we live in is increasingly toxic, and we're seeing epidemic amounts of illnesses that we had never seen before. I mean, we're talking epidemic amounts of chronic fatigue, fibromyalgia, Lyme, mold toxicity, autism, cancer, degenerative neurological diseases. And medicine as we know it has not quite stepped up to the plate to address that in the complicated form that it exists. It keeps looking at it in terms of, surely there's a drug we can give you, and that usually misses the cause. And if you don't treat the cause for any problem, then it's not going to get better.
And, we can trace back, this system of medicine to when penicillin was invented. Before the advent of antibiotics, getting an infection was basically you could die. So when we discover penicillin, then all of a sudden now you can have a medication, a silver bullet for infections, and it transformed the world. Now we're constantly looking for the penicillin quotation mark for cancer, the penicillin for autism, the penicillin, and it's a multifactorial thing. It's not just an infection. So we can look for the next prescription medication for all these multifactorial problems, but we're not going to find it because you cannot encapsulate lifestyle. You cannot encapsulate clean air. You cannot encapsulate clean water. All of those things are going to be really hard to substitute with a pill or a supplement. And it gets really nebulous when you have something as hazy as chronic fatigue syndrome, because it could be caused from so many different things. It could be a reaction to so many different things. First, what can you tell people out there that know maybe that 10, 15 years ago they felt like themselves and all of a sudden they have been on a downward spiral with this chronic fatigue that it's unexplainable? And two, how do you approach the chronic fatigue syndrome patient?
Good place to start. Let me start historically, which was we began to see this massive increase in chronic fatigue in the late 1980s, and didn't really understand what we were looking at. There was very few studies. Most people were thought that it was a psychological issue, and even though they may have had extensive psychotherapy and taken medication, it did not help almost anybody. So for those of us who were looking at it and trying to treat it, it was clear that it wasn't a psychological illness, but it wasn't clear what the physical components were. And over the early 90s, we began to learn about adrenal fatigue, thyroid imbalance, dental components to this. We began to learn about intestinal dysbiosis, in which the intestinal biome was all messed up, food allergy, mold toxicity, Lyme disease began to appear, and we began to understand that there were very specific causes for patients. Now, it wasn't the same cause for everyone, so it wasn't that you could simply plug someone into an algorithm. You really had to take a very careful history and order the right tests to help figure out what that individual had causing it. So, I mean, even back in the early 2000s, Jacob Teitelbaum began writing his papers on how to treat chronic fatigue and fibromyalgia. And in 2007, I wrote my first book on that as well. It was called On Hope and Healing, in which we laid out all of these causes for fibromyalgia. But in the ensuing dozen years since then, what we've become to realize is that for many of these people, that's not sufficient. Many of them now have Lyme disease with its co-infections, other toxicities, including heavy metal toxicity, and the biggie that is now being understood is mold toxicity. So if a healer or a physician of any kind wants to help someone, they really need to be a detective, a medical detective, and they need to start looking for what is the cause for that patient.
And where do you start? And I really want to drive it home that, there's a new documentary series on Netflix right now. It's called Afflicted. And it's almost, highlighting 7 different people that have this weird or like maybe not very popular or maybe not heard of disease processes. Like, one of them has multiple chemical sensitivities. The other one has EMF sensitivity. One has mold exposure. And on the interwebs, when I was reading about this documentary series, people were almost mocking them and then mocking them and then mocking the practitioners who were trying to help them. And it's so frustrating.
Yeah. Unfortunately, that series, from my perspective, was not really well done. It was somewhat ambivalent in how it portrayed people. And very unfortunately, the vast majority of people that I treat with chemical sensitivities and electromagnetic sensitivities and all of the complex symptoms that we're looking at, this is not psychological, although it implied that for many of them it was. This is very real, and it's caused by, for most of them, exposure to Lyme disease and mold. And I can tell you from my own practice, where I've treated thousands of patients in this arena, the vast majority of these folks who have these very complicated histories, so complicated that if a doctor does not know about Lyme, does not know about mold, they're very prone to going, oh, this is in your head. Nobody could be having all of that stuff. But they do. It's very real. They really need to be taken seriously. And there's help available for both diagnosis and treatment. And that's why I wrote my new book, which is what I hope your listeners will be interested in. My new book is called Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness. And it specifically addresses those unfortunate patients who have become unbelievably sensitive to almost anything they put in their body, and tells step by step pretty much how you can help them to get well. And again, I think I hear where you're coming from. It's really important that patients understand this is not in your head. No amount of psychotherapy is going to cure you. You really need to identify the cause and treat it.
It's so frustrating because it's only on your head. It's only in your head up until it happens to you. And then and that's when it becomes real. And, being in this functional medicine sphere, in this health sphere, we see it over and over. We see patients that have chronic fatigue syndrome, and we see patients with fibromyalgia. And in their pain and their fatigue, it's very real. But it's so easy to see it from an outside perspective and just be flippant about it and think that, they just need some therapy. Now, can you compare and contrast? There's like Bartonella or mold toxicity versus like Lyme disease versus, how do you go around, or how can people get some clarity about the different aspects of these triggers? And then is it region specific? We always hear, Northeast, you're going to hear more Lyme. I know Canada is having a lot of problem with Lyme disease right now. And then people I live in Arizona. You might think, no, there's no mold in Arizona because it's so dry. Do you see some differences regionally?
Well, although there are some regional differences, I think it's a mistake to think of it that way, because there is a ton of mold in Arizona. Yes, there's less mold in Arizona than there is in Seattle, but enough mold that some of the country's top mold specialists practice in Phoenix. So I don't think it's helpful to a patient to think about, well, I probably don't have Lyme because I live in Missouri, not in Connecticut, because Lyme is present and reported in every state of the country. And so I would rather switch this discussion to urging patients to think about their illness in terms of their symptoms. And again, in my book, I tried to lay this out as cleanly as I could, where what these illnesses have in common, whether it's mold or Lyme or heavy metal toxicity, a variety of other chronic infections, what they all have in common is that they create a persistent inflammation in the body, and that's all over the body. So that inflammation will affect the brain. So you will get fatigue and cognitive difficulties and emotional difficulties because the limbic system becomes affected. It will affect the joints, the muscles, the lungs, shortness of breath, air hunger. It will affect the liver and how it detoxifies. It will affect the gut so that you will get chronic constipation or diarrhea or both, or gas and bloating. And literally every system in the body is inflamed and affected to varying degrees by these inflammatory stimuli. So what's really important is for each person to look at or list their symptoms to come up with what would logically explain my illness. So for example, if you had Lyme disease, your primary issues might be fatigue, cognitive difficulties, and joint pain. Yes, there's many other things you might have, but those would be central. If you had Bartonella or mold, which is quite similar in terms of how it inflames the body, you might have cognitive difficulties and fatigue, but you would also have a tendency to intense anxiety or depression, unusual tremors or shaking or neurological symptoms in different parts of the body. So each deficiency or inflammatory stimulus has its own unique tendency of symptoms that would help us figure out where that's coming from. Am I answering your question?
Oh, 1,000%. I do want to have, help my listeners triage, because, we can, in functional medicine, I've heard of doctors that say, you have to spend $5,000 in testing before we can even get anywhere. And I don't think that's the answer either.
No, I don't think so. I think there are clinics that in integrative and functional medicine who kind of have a routine in which everybody gets some relatively expensive tests right off the bat. And I'm not really a fan of that. To me, you need to be looking at that patient's symptoms and going, what would be the most likely cause for those symptoms? So where do we want to spend our money so that we'll get the greatest likelihood that we'll really figure out what all's going on here?
Exactly. And then once you decide which way to go, selecting the correct test.
Exactly right. And using that method, we can do just a whole lot better with very, very specifically helping patients to get well.
Now, for multiple chemical sensitivities, do you see a lot of like toxic metals or endocrine disruptors?
We do. The single most common cause of chemical sensitivities from my experience is mold, and the second most common is the infection Bartonella. And it's often triggered by some type of a severe chemical exposure. For example, the forest fires that we have had in California recently have been a trigger for many people, that it just sort of overwhelms the body's nervous system. Many people have thought of chemical sensitivities as kind of like allergy, but it's not. It's an inflammation of the nervous system that becomes hyperreactive to what it is stimulated by, particularly from a sense of smell. So you can get any of several chemical smells or smoke or a variety of other olfactory stimuli, which immediately, within seconds, starts to inflame parts of the brain and can cause patients to be either cognitively impaired or suddenly weakened or have some odd neurological symptoms, headaches, almost within seconds of exposure. Now, allergies don't do that, but these chemical exposures do, and we're seeing many, many, many more patients with chemical sensitivities. And again, these are very related to some of the things we've been talking about, particularly Lyme and mold, often inflame the parts of the brain to sensitize patients, and then they're off to the races once they get certain chemicals, adding to that burden of overstimulation that creates that symptom.
Do you have any experience with like Marcons and the co-infections with biofilms?
I do, and I don't think Marcons is as important as some people have made it out to be. You know, I worked with Dr. Shoemaker for many years, teaching together and studying together, and in the very beginning, it was his belief that Marcons was one of those things that needed to be looked at, that was central for treatment. And I treated my patients by his protocol extensively, and I almost never saw much benefit. So I have come to feel, and many other people are agreeing with me, that he perhaps has overemphasized the importance of Marcons. I mean, and to me, to be very honest, I don't even measure it anymore because I really don't think it's a major component of illness. I think there are many, many more important pieces that need to be looked at and treated. But that's my bias.
How do you test for mold?
Well, the major way to test for mold is actually very simple and quite accurate, which is there are two major companies in the country that have the ability to measure mold toxin in the urine. And so the best tests are from the company Real-Time or the other company Great Plains Laboratory. They do very different tests with very different technologies, but both tests are really quite useful because they're measuring different things. But very simply, you submit a urine specimen to them, and they can tell you very, very quickly whether or not there is mold toxin in your body, which very strongly implies that you're mold toxic. And it's kind of like, yeah, no-brainer.
We touched on Marcons, we touched on mold, Lyme. Do you deal with any viruses?
Well, that's a complicated question. When the immune system gets weakened by both mold and Lyme disease, it gives the opportunity for other opportunistic infections to resurface. So there's always residual infectious agents in our body that our immune system, when it's working right, keeps in check. So there's a host of viruses, mycoplasmas, chlamydias, a wide variety of organisms that, when we're healthy, they can be present dormant or latent, and it's not doing anything because our immune system is totally keeping it in check. But when our immune system gets weakened, it loses containment, and some of those organisms become part of the problem. Generally, they're not the major part of the problem. The major part of the problem is still what caused that immune system to get weak in the first place. Meaning, I'm sorry for beating this drum, but it's almost always mold and Lyme or co-infections. So, yes, we can measure that there is viral infections present. We can measure that there are other infectious agents present. But the reason I don't think they're as important is when we cure the mold and when we cure the Lyme, the immune system gets rebooted, it gets restored, and it doesn't look like you have to do any additional treatment. The flip side of that is if you start treating a virus when what's really going on is mold or Lyme, you're not going to make much progress. That patient's not going to get better because you're not really treating the primary cause.
So do you even test for like EBV or CMV?
Oh, yeah, you can test for it. And the majority of our patients have evidence that there is residual infections of CMV and HHV6 and Epstein-Barr virus, Coxsackie virus, echoviruses. Oh, we have them. But the more important question is that what is making this patient ill?
Do you even need to treat it?
Right. Because I think that's the biggest problem that I see with functional medicine doctors who are very capable of measuring all of these things. And then what I watch is they're not sure what the primary problem is, and so they'll just pick one. And I've had countless patients treated for Epstein-Barr and methylation problems for several years, making no benefits because they're not treating the right issue. And again, I would come back to the primary important focus is, would that diagnosis explain all of my patient's symptoms?
In things like methylation, it's not like if a person is an under-methylator or an over-methylator, it's not going to be like, well, since your methylation status is normal, you don't need to worry about getting your B vitamins and your folate. It's like...
but it's not normal in any of these patients with chronic illness.
Correct, yeah.
The body actually intentionally shuts down methylation to protect itself. So none of my patients methylate very well, but we have to understand that that's part of the natural defense mechanism. In other words, just to give you a more specific example, if a virus is infecting the body intentionally stops methylating because in order for that virus to replicate or grow, it has to hijack our methylation chemistry to do so because it can't grow on its own. It needs our chemistry to make that happen. So our body intentionally shuts that down to keep them from doing that. So if you think, oh my goodness, you're an MTHFR, double homozygous, I've got to get you methylating again. If you are not in sync with what the body wants, you're not going to get anywhere. In fact, many of my more sensitive patients, when they attempt to take even minuscule doses of methylation materials, get much worse. So it's not as simple as can you methylate, it's can you be in sync with the body's readiness to resume methylation? And that's a question that not enough people ask.
And the body does that with multiple things, like for example, iron. It hides your iron, and it prevents, because iron is needed for for life to happen, and it also does that with the mitochondria. It kind of shuts down mitochondria to prevent the hijacking of ATP.
Correct. And again, people throw around the diagnosis of mitochondrial dysfunction. Well, the mitochondria are what monitor the threats to the body, particularly threats in the form of toxins and infection. And it shuts itself down to protect itself. So once again, it's kind of, forgive me, super obvious. All of my patients have mitochondrial dysfunction. And simply given the natural materials that we use to help the mitochondria work better won't work until you get the toxins out or fix the infection. Then the body can take those materials and run with it.
You might exacerbate the problem because the body is doing its intelligent, mechanisms, and it's shutting down mitochondria to prevent the widespread of these infections.
Exactly. So even well-intentioned, this isn't working well or this isn't working well, in a sense, that's using the old medical model of, this is deficient, I will give you this. Without looking at the bigger and more complicated picture is the body ready for it? When was the body ready for it? It's not as simple as this is deficient, take this and you will get well. Now you have to look at a much deeper level in order to really help people improve.
So we've gone through the gamut, okay? So let's talk about hope, okay? What can people do, or how do you help people get over these infections, and how do you help patients that have been ravaged by Lyme, mold, Bartonella, and CFS in what they need to rebuild and reboot their bodies on a system by system basis?
Well, again, I'm going to come back to diagnosis first, which is number one, you need to be in tune with that body about what it's asking for. That's the starting point. And many, if not most of my patients have mold toxicity and co-infections and Lyme disease and heavy metal toxicity and methylation and mitochondria. So it's not an either or. So where do you usually start? As a general rule, most patients who have it need to have their mold toxicity treated first. If you don't do that, you're going to have a really difficult time getting at the Lyme, which is often underneath that or part of that. So in terms of priority of treatment, it's generally mold first, Lyme and co-infection second. For most patients, once you have done that, it's relatively easy then to figure out what else they need to really rebuild themselves and get rebooted. So at that point, they will start responding much better to looking at their adrenal and giving them whatever adrenal materials their body needs. It might be DHEA, it might be pregnenolone, it could be mineralocorticoids or cortisol. You need to look at thyroid, which is almost always messed up by these inflammatory conditions. You need to measure not just TSH, which is what most doctors look at, but reverse T3s and T3s and T4s and get the whole thyroid picture so you give the right supplements. You need to look at estrogen metabolism for women and testosterone for men. You need to look at heavy metal toxicity for everybody. You need to look at the intestinal balances. I like doing stool testing in which you can look at, are there good bacteria present in adequate amount? Are there toxic bacteria? Are there yeast? Parasites need to be looked at and addressed if they are present. Food allergy needs to be looked at, and the newer understanding of mast cell activation needs to be looked at. You need to look at the body's ability to detoxify. So you need to be supporting the liver and the kidneys and the gallbladder and the skin, the intestinal health. All of those need to be looked at in, if you will, a complicated dance. But if you do, to answer your questions, the vast majority of the patients that I've treated get well. And we can throw around the word cure, but many of them get well enough that they are off all medications and supplements and feel great. Are they fully cured? No one knows for sure, but they sure behave like it.
And who cares, as long as the patient, we treat patients, we don't treat paper.
Yeah, and so we can argue whether Lyme is merely is contained or cured, but from a biochemical, physiological point of view, as you're saying correctly, it doesn't matter. Because once that immune system is rebooted, it will take care of those things on its own. It just has to recover its health enough so that it can do its own job properly.
And what are you using to help people get rid of like Bartonella and mold? Is it herbals, prescription medication, a combination? How do you approach those chronic infections?
Okay, well that's a whole another broadcast. But the simple answer to, first of all, if we're treating mold, we need to look at three major components. Number one, we really need to analyze that patient's home environment and work environment to be sure that they are not being re-exposed there. Because if they are, they won't get well. So super important is that you need to know where you got your mold exposure, and if it's ongoing and current, you won't get well unless you can either remediate it or get out of there. Second, you need to take the correct binders that will bind specifically the toxins that are making you sick. And again, in my book, Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, et cetera, I outline very, very carefully there which mold toxins are bound best by which binders, so that both physicians and patients will have an idea about what they ought to be taking that will help pull the toxin out of their body. And last, and this is a very important piece, most of my patients have colonized so that even if they are no longer living in a moldy environment, the mold has actually colonized or is growing in their sinus and or gut areas, making toxin ongoing. So most of those patients will need to take antifungal materials and biofilm dissolving agents to get the mold and the candida out of there. So that's the mold issue. Now, Lyme and co-infections is even more complicated because that typically involves taking antibiotics and supplements and nutrients. It's a very, very complicated infection and has to be approached in a comprehensive way.
And what about for toxic metals? Do you do chelation therapy?
Yes. Even looking for toxic metals, as a general rule, you're not going to get an accurate analysis of what's in that body unless you test using a chelating agent and then checking what's in the urine. So the most accurate from my experience is using intravenous DNPS and EDTA. And for people who are more sensitive or can't have access to that, doing DMSA. So taking one of those and then collecting the urine will give you a much more accurate understanding of what's in that body. And then, depending on which toxic metals we see, we'll usually use some form of chelation to pull that out of the body. And again, that'll vary depending on which metal is the culprit.
It's exactly the protocol that we use. We use an IV solution, with DMPS and EDTA. And I think that two reasons, it has the affinity, towards the lead-like compounds and the affinity towards the mercury-like compounds. And then the synergism of the two helps you get a complete picture of what's going on with the toxic metals.
Yeah, I completely agree that for exactly those reasons.
And then have you used, I've seen a couple of products of like EDTA lozenges or sublingual. Have you ever used any of that?
To my knowledge, EDTA is not absorbed sublingually or through a suppository. Now, there's a variety of uses of EDTA. For example, it's a great biofilm dissolving agent. So I do use it orally and as a nasal spray to help in that area. But from my experience, it just doesn't work as well used in those forms. And I know it's expensive and invasive to do it intravenously, but again, in my experience, that works much better.
Yeah, and it's such a life changer, for people that have those that metal toxicity. Using that synergism, it's gentle and it's fast, and I really encourage my patients to do the IV therapy when possible. Fantastic information, and it just makes me so happy that there's people like you, because treating chronic fatigue syndrome is not easy. It has so many faces, it has so many ways of presenting, and it could have so many different reasons, and I'm just happy to have pros like you that specialize in fibro and this type of presentation of disease. Where can people find you? How can people get a hold of you? When can they get the book, and how can they get the book? Because I know that this information, it is life changing.
You can start with the book. Anybody can get the book. It's available on Amazon in both Kindle and paperback form. Very easy to get hold of. And for any of you who have family or loved ones or friends who are really wrestling with this, I wrote this with the hope that this would give hope and information so that you kind of know where to start and how to proceed. So again, the name is simply called Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, and there's a lot of other words in there. But that's basic. That's the basics. in terms of where can you find people like me who do this kind of work, let me recommend to your listeners an organization called ICI. That's ISEAI. It stands for the International Society for Environmentally Acquired Illness. I would encourage readers and physicians to go to the ICI.org website. For physicians, there's going to be a certification process and national meeting that will be held in May of this year in Phoenix. For patients, go to the practitioner site where you can get a list of practitioners who are trained and or certified in being able to analyze your body from a comprehensive standpoint that includes mold and Lyme and heavy metals and everything else we're talking about. In terms of me, that's a lot harder. My practice is full. I'm accepting very, very few new patients. I practice in a small community in Redwood Valley, California. You can go to my website, get a lot of information there, and that is very simply www.neilnathanmd.com. And I have a newsletter, I have blogs that you can listen to, I have archived radio shows that may be helpful to you. But basically, a large part of my practice and what I'm doing now is I'm very much wanting to teach healthcare providers what I know. And so I am doing consultations. So if those of you want me to consult with your healthcare provider and you, I am doing a large number of conference call type consultations with the healthcare provider and the patient on the line at the same time so that I can help them with both diagnosis and treatment.
Thank you so much. I know we're going to get a lot of interest from this interview. So why don't we, circle back and take some questions from Facebook just so we can help more people and encourage more people to get the book for their friends and get their books for themselves and just to know that there is some hope out there for you.
That'd be a good start.
Awesome. Thank you so much, Neil. I really enjoyed having you on the show. And, I can't wait to, continue researching this and maybe I'll see you here in Arizona when the conference comes over.
That would be wonderful. We'd love to have you. So thank you, Guillermo, for having me.
No problem. Thank you and have a nice day.